not TV actors. We are real. Like you. Dental Designs, more than a smile.
Can all dentists do IV sedation? In all respects, not all dentists can actually do IV sedation. In the state of Florida, you have to require a permit. You have to go to your classes and certifications in order to make sure that you can provide these fabulous procedures for our patients. At Dental Designs, I'm permitted to be able to provide IV sedation, and my staff members are qualified in order to make sure that you have a great experience and a great procedure as painless as possible throughout your entire appointment. Congratulations, you're actually the winner.
Appreciate it.
You're welcome. We're going to do braces on her. We're going to continue this throughout the entire journey.
You're the winner now for real.
This is what I wrote to be in the contest. To whom it may concern, I believe I should win the braces because I have been needing them for a while now and can never get them because money was always an issue. I got a consultation back in January, but never got my braces because it was too expensive. Over time, my teeth have gotten worse, and now I really need them. My whole family has been patients with Dr. Padilla for over 10 years. We all do our best to maintain our teeth and to keep them clean and healthy. I look forward to hopefully being the winner. Sincerely, Elizabeth Sanchez. Thank you in advance, Dr. Padilla.
Sedation dentistry is a wonderful thing. It's wonderful to go through a procedure and not know actually what the procedure is and not have the experience of having to go through the pain and suffering of it. So sedation dentistry is a wonderful way to give dentistry to our patients. I'm glad that we are one of the very few dentists in the area that's actually permitted by the state of Florida, so we can actually provide sedation dentistry within our office. We provide the monitoring, the medications, and the safety that you require in order to go through the actual procedure and have a better experience with dentistry. So again, welcome to Dental Designs, where we actually provide all sedation dentistry for our patients. Can patients with disabilities still receive oral care? In most situations, patients with disabilities really need a lot more dental care than most typical people. They don't have the capacity to be able to take care of themselves for the most part, so we have to allow them and help them depending on the severity of their disability. So yes, they do need some oral care. We just have to figure out how that oral care has to be addressed. We have some patients that do not tolerate being in the dental chair for any amount of time, and this is where IV sedation comes in handy so that that patient still can receive their dental care and their dental needs under the effects of IV sedation. There is no barrier. We just have to figure out how to address it, but definitely these patients still need some well taken care of in terms of the dentistry that they need to have done to make sure that their hygiene and their teeth last as long as possible.
Hi, I'm Wishali, and I'm retired now. But before I was retired, I was a spiritual teacher, a personal growth teacher, author, lecturer. I came to Florida. I did my research. I had my wish list of the right education, the right background, the right training, the right experience. And I put it into the online wish list search, and there was only one person that came up that had everything that I need to make sure that I'm gonna get my $1 million smile. And it was Dr. Padilla. He talked to me about my life, what it was that I did, and he explained to me that what we could do is the wire braces at first until the heavy lifting was done, and then we could transition into the Invisalign so I could feel more confident about public speaking. The ladies, I have asked the ladies 1,000,000 times to marry me and have my babies because these people are fabulous. Here at Dental Designs, we're more than a smile.
Cuidar y aprender sobre la salud oral garantiza el futuro de tus hijos. Cuidamos tu futuro.
Dental Designs, más que una sonrisa.
Visita nuestras oficinas en Naples y Fort Myers. Llámanos al 628-1300.
Hi, I'm Judy Gardner. I'm a fitness trainer and personal trainer here in Naples, and I'm at Dr. Padilla's Dental Design today to tell you not only how wonderful Dr. Padilla and his staff are, but to let you know how caring he is in many ways, not just professionally, but a couple weeks ago he had me come in for an hour or so to train his staff. How fun is that, to have the dentist and his staff work out? He's very caring and professional, and you couldn't ask for a better facility. Everything is clean and uplifting. It makes you feel good. I feel good when I come here, and I don't always hear many people say they're happy when they go to a dentist, but I am. I don't know anything else to say other than if you would like to have a great doctor, a great facility, a great outlet for your teeth and a healthy smile, see Dr. Padilla at Dental Designs. More than a smile.
Is it normal to have sensitivity after a filling has been done? Having sensitivity after a filling has been done is actually normal because there is a certain trauma that has been done to the tooth during the actual process. Usually the sensitivity should last between 2, maximum 4 weeks. Anytime after it lasts more than 4 weeks, there's definitely a concern or a problem that may be going on that may have to be addressed. That's why at Dental Designs we do follow-up appointment times to make sure that your filling is not only doing well, but that your sensitivity has actually gone away so you can live your life as normally as possible. What are the Fabulous 6? The Fabulous 6 is a term that we use in dentistry as when people only want to take care of the teeth that are in front of their mouth. Again, from canine to canine. And usually most people do that in order to save money. But in the long run, that actually causes more problems because then the teeth that are behind those teeth are actually getting destroyed and ultimately they lose them. Losing these teeth is critical because the bite now does not have any support as they chew, and all the pressure goes to the front teeth, making them move or splay and ultimately losing the rest of their teeth. So our advice is please take care of the teeth in the back so that we have support for those beautiful front teeth that we consider the beauty of our smile. Did you know that teeth can have more than 3 roots? It really depends on the person and where they come from. Teeth can have all sorts of shapes and sizes. Here at Dental Designs, we're trying to not only look at these factors, but also be able to treat them the best way possible so that patients can have their treatment finalized. Sometimes we found more than 4 roots, 5 roots, and inside, when we actually do root canal therapy, we found 4, 5, or even 6 canals, but our goal is to make sure that they are all treated so that you can get the help that you need when the time comes. What are the benefits of having dental implants? Dental implants are a great way to replace teeth without having to use one of our own teeth to replace those teeth that we've actually lost. So dental implants are actually placed in your bone, and not only it allows us to replace those teeth, but also tells that bone to actually stay in position, so we actually conserve more of your bone, so in the long term we have a better dentition. Hi, I'm Dr. Padilla. I would like to welcome you to our offices in Naples and Fort Myers, and in our website, topdentaldesigns.com. Dental Designs, more than a smile.
Hi, my name is Marilyn Elwood. My experiences and access to knowledge and opinions has led me to choose Dr. Padilla at Dental Designs for my dentist. I've been a patient of his for more than 25 years. His special talents and techniques in all areas of dentistry would suggest that he has a great deal of integrity, compassion, and honesty. He genuinely enjoys his patients. He listens to their concerns and needs. His highly trained staff completes a circle of teamwork, making your visit to his office a pleasant and unique experience. Dental Designs, more than a smile.
What's the difference between conscious sedation and IV sedation? Conscious sedation is when we actually provide the patient a pill or medication similar to triazolam so that the patient can actually go into a level of sedation. It is only permitted to do conscious sedation to give only one dosage of that medication. But not all patients undergo sedation with that one dose. That's why we also have the option, as long as you're permitted, to be able to do IV sedation. IV sedation is when we place an IV, and in a couple of seconds the patient is actually under the effect of the sedative, and now we can actually control how they're resting, how they're going through all their vitals, making sure that they're controlled and still get their treatment done under a safe environment.
¿Tienes water pick en la casa? Es un water pick, eso lo que hace es que remueve toda la comida de los brackets a presión de agua. Okay. Y es muy bueno. No quiere decir que reemplaza el floss. No. El hilo dental tiene que usarlo diario. Mínimo 2 veces al día. So, ya regreso.
What patients are candidates for aligners? Aligners can be used with all sorts of patients in terms of ages. It just depends on what expectations the patients have. Most aligners are done on relapse cases where patients have certain movements of teeth after they've had actual orthodontics in the past. We can do aligners on teenagers, we can do aligners on young adults or older people, depending on what their expectations are to be. Aligners are a fantastic way of not only moving the teeth, but making the process as comfortable as possible for patients. Perfect example of a great way of simplifying the situation for patients, but still getting a great orthodontic outcome.
Hi, I am Dr. Evelyn Critchfield. I graduated from the University of Florida 3 years ago. For the past 2 years, I've had the privilege of working at the Fort Myers Dental Designs office. Here at this office, we pride ourselves in providing our patients with the best comprehensive care. We do everything from fillings, crowns, bridges, implants, orthodontics, and now we're even providing teeth in a day. We're here to serve you and our community. Here at Dental Designs, we are more than a smile.
What is a dental implant? A dental implant is a titanium fixture that's actually replacing a natural root from a tooth. Sometimes we lose teeth due to circumstances, due to fractures, or sometimes we have long bridges that after a while they just don't hold up. So implants are utilized to not only replace one tooth, we can replace multiple teeth, allowing us to not only function and bite, but look beautiful with something that does not come off again. Why is CEREC different from typical dental impressions? CEREC has allowed us to be able to create three-dimensional models that We would typically take impressions for patients in the past in order to fabricate crowns or the retainers. But doing these 3D models allows us to not only give the patient a better experience, but we avoid all the gagging reflexes that patients would have and the annoyance of all the material that patients would just not like throughout the experience of dentistry, making this a much more pleasant experience and much easier for the patient to get their final restoration done, usually on the same day. So it is a fascinating thing for patients, and we're very glad that we at Dental Designs have this technology to be able to provide you a much better experience.
Hi, my name is Barbara Huller. Well, a little over 2 years ago, I lost a cap. We looked at this building and we said, well, why don't we try there? And if we don't like it, we can turn around and walk out. But from the minute we walked in, the entire atmosphere of the office and of the people we came in contact were so warm and open and friendly that we felt comfortable right away. And I was very impressed with their offices and the equipment, but more than anything else, how each staff member here treated me. When we left here, my husband and I both said, well, we found our dentist. If you're interested in a good dental service, professional, I would highly recommend coming here. Here at Dental Designs, we are more than a smile.
Hi, I'm Dr. Orcutt. I'm part of the team here at Dental Designs. I'm originally from Fairbanks, Alaska, but I went to dental school in Fort Lauderdale at Nova Southeastern University. Here at Dental Designs, we have some of the best technology available in dentistry, and we strive to go above and beyond for our patients. We offer things like implants, bridges, whatever your dental need is. We would invite you to come in and see us today. Here at Dental Designs, we're more than a smile.
Staying young, how losing your teeth can actually make you look older. As we start losing teeth, we start losing support in our mouth. As we lose support, everything starts collapsing and our cheeks and all our tissues start degrading. Also, our bone starts to go away. So there's a function of that tooth to actually be there, not only to keep the teeth, but also keep the support of everything. So as we keep losing and losing, to lose a tooth is very easy to do. To gain it back is more of a struggle. Let's try to keep everything that we have as much as we can. That way we stay young and better looking. Not that we are less better looking as we age, but nobody likes the aging process. Let's see if we can actually avoid it.
Hello, I am Dr. Sweeney, and it's so wonderful to be here today to tell you a little bit about the wonderful work of Dr. Padilla and his group of specialists here. I came to this practice and the quality of dentistry here is extremely high. Doctor and his group of people put you at ease. They make you feel comfortable and warm here. And it's something that I rather look forward to. I never believed I would say that about coming to the dentist, but here with Dr. Padilla and his group of people, I honestly can say that. It's a fun experience. This is my opportunity to invite you to have the experience that I've had by coming here to Dental Designs. You won't regret it.
I'm Joan Wohlers, and my family and I have been patients of Dr. Padilla's for a number of years. My first experience with Dr. Padilla was when our disabled son needed some extractions and a bridge. Dr. Padilla was so kind and patient and treated us as if we were family. He made the experience as comfortable and easy as he possibly could and kept our son calm. We were amazed and thrilled that the work, including the bridge, was done within a few hours on the same day. I'm always impressed that he doesn't promote more costly procedures if he doesn't feel it's necessary. We've never hesitated to recommend Dr. Padilla to anyone needing a dentist. He and his staff are extraordinarily kind yet professional, and we couldn't be more pleased that he's our family dentist.
Why is dentistry so expensive? Throughout the years, we've been trying to make sure that we provide you the best outcome and the best technology for dentistry. Here at Dental Designs, we have some top providers that are highly educated that can give you the best treatment for you under the circumstances. That allows you to have great dentistry depending on the level of service. How expensive is your treatment depends on what level of service you actually need. The simpler your problem, the less expensive it actually is. The longer we wait for the problem to be addressed, the more expenses start to arise. Here at Dental Designs, we provide you with many options depending on the level of care that you would like to have for your teeth. And again, we have great providers, great materials, and great technology to be able to provide you many options for your dental needs. Ultimately, it's an investment for your health.
Hi, I'm Barbara Ann McKinney and a patient of Dr. Padilla. When I first moved to Naples, I had been going to another practice and was not very happy. And my friend had recommended Dr. Padilla, and to be very honest with you, that was the best thing that ever happened. I just love, and who loves going to the dentist? But I love coming here. His work is impeccable, his staff is beyond reproach. There are not enough superlatives to say about this practice and Dr. Padilla. As far as I'm concerned, he's the best dentist in Naples. You know, you might really want to consider coming here and being a part of Dr. Padilla's family. Please come and join us here at Dental Designs. We're more than a smile.
Dental Designs, más que una sonrisa. Can patients with a holistic approach have dental treatment done? Absolutely yes. Patients that have a holistic approach can have dentistry done, but we as dentists, we have to know all the materials that are acceptable in order to make sure that they have the best outcome. So between ceramics, composites, resins that we utilize, in order to make sure that we have the best treatment possible for the patient, we have all that here at Dental Designs. So we can actually approach the patient in the best way possible, still keeping their natural and holistic approach as neutral as possible without free radicals. So you can contact us at 239-628-1300 at Dental Designs, and we can provide the holistic approach for your dental needs. Dental Designs, more than a smile. Is diabetes a factor for tooth problems? When a patient is diabetic, as long as their diabetes is under control, diabetes is not a total factor for having teeth problems, but diabetes can be linked to how the healing process is involved with the patient. So making sure that we monitor the patient, that we monitor their sugar levels, that they're taking their medications is critical to making sure that the treatment that they're going to have is going to be having a great outcome, and that the patient will have a great prognosis and that their treatment is going to be well. But not having the diabetes under control will bring complications of the healing factors, and then that's going to either cause more gum disease, or let's say implants don't take because of diabetes not being under control. So diabetes has to be under control, has to be monitored in order to make sure that the patient can actually get their treatment adequately done.
Hi, my name is Heather Burrell. I've been a patient of Dr. Padilla since 2012. He's probably the best dentist I've ever had. The staff here is wonderful. I would not go anywhere else. I trust Dr. Padilla with all my health care needs. He knows I have some health issues and he works around those all the time. He's so good at what he does and I trust him totally, and I now have my husband of the last 2 years coming to Dr. Padilla as well. All the patients here, including myself, are part of the family. And here at Dental Designs, we are more than a smile.
My name is Bailey Harmon. I'm 21 years old and I'm a student at Florida Gulf Coast University. I originally came in here because I was having a lot of pain in my jaw, and the doctor came in and described to me exactly what the disorder was that I had, and he was very patient and considerate about the treatments that I would have to go through, and it was a very pleasant experience because it is very traumatic to hear that I have a disorder that I didn't know about my entire life. It's a good dentist to come to. I suggest it to all my friends and all my family members because of the personable experience I always have. Here at Dental Designs, we're more than a smile.
Hi, my name is Timea and I work for Dental Designs for Dr. Padilla. I'm very thankful to Dr. Padilla and to Dental Designs sponsoring my son Sebastian's DOSA basketball team.
Hi, my name is Justin Anderson. I'm the head varsity basketball coach here at St. John Newman Catholic High School in Naples, Florida. We felt that St. John Newman was a good fit for Sebastian. Sebastian was able to be awarded the Justin Havlicek scholarship that's awarded to students. And then we're just really grateful, his family and Sebastian are here. We'd like to thank Dental Design for their support, and we just hope to continue this relationship for the next 4 years as Sebastian moves on into our program.
Hello, my name is Sebastian Dosa. I'm a freshman at St. John Newman Catholic High School. I found Justin Anderson, or Coach Anderson, to help me with the fundamentals, and I just want to thank Dental Designs for sponsoring me and my team.
Dental Designs, more than a smile.
The question arising of how often should I brush my teeth can be answered very easily. Usually, we recommend that people brush your teeth minimally 3 times a day. Usually in the morning after they wake up, during the day, usually after school or after work, and at nighttime before definitely going to bed. Now, the frequency depends on our habits. The more we eat and the more conditions we have, the more we have to maintain our mouths. So we have to take it on a person-to-person basis. But minimally 3 times a day is more than sufficient for people to actually brush your teeth and maintain a good oral hygiene. Of course, we cannot forget about flossing. We have to make sure that we floss that food that's right between our teeth. If any questions arise, you can always contact us at Dental Designs at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. Can aligners replace conventional orthodontic braces? In many instances, aligners have become one of the new trends of being able to do orthodontics, where we can actually move all the teeth a patient needs to have moved, all done computerized by our 3D digital systems. We can actually create a set of aligners that patients will change every 2 to 4 weeks to be able to move their teeth. There are some patients and there are some limitations for what these cases can actually be done. So that's why we encourage patients to come in for a consultation. During the consultation, we can give the patient the alternatives of what can actually happen, how much they can actually move, and whether aligners are going to be an option for them, or do we just have to stay with conventional orthodontics. That way, you can always contact us at Dental Designs at 239-628-1300 in Naples and Fort Myers, or you can visit us at topdentaldesigns.com. How often should I get cleanings done if I've had a pre-existing periodontal condition? When a patient already has a pre-existing periodontal condition, you definitely have to maintain your gums better than most other people. That means that you're very prone to having gum disease, and we definitely have to keep up with you a bit more often. I've had patients on a 2-month recall, 3-month recall, 4-month recall until we graduate them into a 6-month recall minimally. But we're looking for what's going to maintain that patient in the best health possible so that they don't go back to having gum disease again. Gum disease can be controlled, but we have to be meticulous. Not only do we as professionals have to help you get that, but we also have to teach you how to maintain it so that we can maintain a great oral hygiene. Any questions, you can always contact us at Dental Designs at 239-628-1300 in Naples and Fort Myers, or at topdentaldesigns.com. Dental Designs, more than a smile. Sometimes I have clients asking me, how often should I go for a dental cleaning? Dental cleanings are encouraged to be done minimally every 6 months. Now, there are some circumstances where patients have or are prone to gum disease or have gingivitis, and sometimes we have to bring them a bit more often or do treatments that are far more profound than just a regular conventional cleaning. But more than often, minimally, patients should be visiting their dentist every 6 months. You can always contact us at Dental Designs in Naples and Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. How can we prevent premature bone loss? When we start losing teeth and we do not restore these teeth with dental implants, our bone tends to be receding, and prematurely we start getting wrinkles or collapsation of our mouths and we lose our vertical height. But by placing dental implants in time, we now stimulate that bone to stay within the boundaries that we had it before and keeping that facial feature that we all love as we were in our 40s or 30s. In the event that you have this situation where you're losing bone or you've lost teeth, and you have Medicare, Medicare's priority is to make sure that their patients not only conserve their bone, but that we can restore their bone under their program at a discounted rate. Again, this is only available at Dental Designs in Southwest Florida, and you can take advantage of it. You can always contact us at Dental Designs at 239-628-1300 or at topdentaldesigns.com, and you can request a consultation with me or one of my associates at Naples or Fort Myers. Dental Designs, more than a smile. Can aligners replace conventional orthodontic braces? In many instances, aligners have become one of the new trends of being able to do orthodontics, where we can actually move all the teeth a patient needs to have moved, all done computerized by our 3D digital systems. We can actually create a set of aligners that patients will change every 2 to 4 weeks to be able to move their teeth. There are some patients and there are some limitations for what these cases can actually be done. So that's why we encourage patients to come in for a consultation. During the consultation, we can give the patient the alternatives of what can actually happen, how much they can actually move, and whether aligners are going to be an option for them, or do we just have to stay with conventional orthodontics. That way, you can always contact us at Dental Designs at 239-628-1300 in Naples and Fort Myers, or you can visit us at topdentaldesigns.com. We always have the question of, is extracting our tooth or removing our tooth the only solution that we have for our concern? For years, it was always thought that removing a tooth was the solution to getting rid of infections or problems with our teeth. But nowadays, we have different solutions to make sure that we keep what we have as long as we can. Always remember that we never know what we have until we lose it. Not having teeth in the area can cause shifting of the other teeth or shifting of our jaws and complicating, in many situations, having headaches or migraines because that jaw has shifted into different areas or places. Also, we can't chew on one side, so now we favor the other side, and we're abusing the other side, causing more teeth to actually get damaged. So that's why nowadays we have different ways of treating these areas. Let it be that we have to lose a tooth, then we can always graft the area and have a new tooth placed by the way of an implant. Or if we can actually keep that tooth, we can actually do root canal therapy and treat the tooth and keep it there for many more years to come. So there are options out there to make sure that we actually keep our teeth as long as we can and as comfortably as possible. Here at Dental Designs, we always bring you in for a consultation so we can give you all those options possible. Once you have those options, and now you can actually make your wisest decision based on, let it be your financial solutions that you have available or what your desires are to be. But again, there's a gamma of solutions available for you, and especially here in Dental Designs, we encompass more than possible solutions for all your dental needs. You can always contact us here at Dental Designs in Naples and Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. Hi guys, here at Dental Designs, we are not only concerned about your quality of dentistry, we're worried about your quality of life. So we want you guys to go out there this summer, have a great time, travel, spend time with your families, because at Dental Designs, we're more than a smile. How does Medicare work? Medicare is an insurance that patients have that within the realms of dentistry has no benefit for any dental procedures. But when patients have lost teeth and cannot eat or function adequately, that's where Medicare kicks in. And now patients have a benefit to be able to restore their smile by being able to have implants and bone grafting that now allows them to have a stable smile and eat more adequately. Patients that come can save 60–70% of the overall cost of a dental implant just through their Medicare plan. So we encourage patients to always let us know what type of Medicare plan they have, provide us that information, and we can verify it for them to see if they have a benefit that they didn't even know that they had. So it's a benefit that is beautiful for the patient, saves them a lot of money, but provides them a bigger benefit in giving them a beautiful, longer lasting smile. So you can always contact us at Dental Designs at 239-628-1300 or at topdentaldesigns.com for more information. Dental Designs, more than a smile. Here at Dental Designs, we're always trying to improve our technology. As we can see right behind me, we have our CEREC machines. Now our patients can actually see the process firsthand as soon as they come into our office, let it be in Naples or in Fort Myers. This technology allows us to be able to create crowns, bridges, implant restorations, in most situations usually the same day, making the process a lot easier for our patients to get the restorative needs done in a faster way and in a more predictable way, and very durable as well. You can always contact us at Naples or Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. Who is a candidate for dental implants? Any patient above the age of 18 that has lost a tooth or several teeth is a candidate for dental implants as long as the medical requirements are there. One, we definitely need to have bone. Otherwise, we can always do bone grafting and increase the area of bone that we actually need. Second, we need to make sure that there are no medical contraindications for it, as well as medications like bisphosphonates, medications such as Boniva, Fosamax, Reclass, Prolia. All these medications change the chemistry in the bone and allow the bone not to heal properly under given circumstances. Our goal is to make sure that we look at your consultation, figure out what your situation is, evaluate your medical history, and provide the best alternative possible with a long, stable, lasting smile. You can always contact us at Dental Designs at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. What type of procedures are done at Dental Designs? Dental Designs is a general dental practice. Not only do basic dental procedures like fillings, crowns, root canals, and even orthodontics, but we're also an advanced dental practice where we do implant dentistry, bone grafting, and IV sedation. For all needs that you have, let it be replacing teeth or getting that beautiful smile with veneers or crowns, you can always contact us at Dental Designs. Especially now for patients that have Medicare, Medicare has allowed us to become the premier dental facility since we do a lot of advanced procedures in bone grafting and implant dentistry. Now patients can have that type of benefit through Medicare, and we always encourage you guys to call us and contact us in order to see if you are a candidate for that type of service. At Dental Designs, we are here to provide all areas of dentistry for you. You can always contact us at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile.
My name is Ana Soto. I'm a Naples resident. Thanks to Dr. Padilla, the only Medicare certified dentist in Southwest Florida, I've been able to obtain a treatment that I could not have done in any other place. When I started my treatment, I was very nervous, but Dr. Padilla gave me so much confidence. Not only him, but also his staff make me feel like I'm part of this family. That's why I believe here at Dental Designs, we are more than a smile.
Hi, I'm Dr. Ramon Padilla, founder and owner of Dental Designs of Naples and Fort Myers. Most of our patients ask us, what do your patients like about your office? What they do love is the ability to have their treatment done from start to finish in one facility. The level of technology that we have, as well as the caliber of the instrumentation that we provide within our office, allows us to give you the best possible dentistry available within the U.S. And our patients love the fact that they can do that. The other aspect that they do like is the fact that we do IV sedation. Now we can actually take all that dentistry and oral surgery and orthodontics that we can actually do. In many situations, we can do it in one simple appointment to be able to allow those patients to have the experience of dentistry without the hassle of everything else that they do not like or despise. So again, you can always contact us in Naples or Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. How much does dental treatment cost? We always get many phone calls and actually social media questions about dental treatment, how much do they cost? And even though we want to answer them the best way possible, it's very difficult for us to know exactly to what degree your condition is and how much work is going to be involved. We have patients that have simple situations and some that we think it's simple and it becomes a more complicated situation. That's why here at Dental Designs, we invite you for a free consultation so that we can now find out what your situation is, how complex it is, and what do we have to do in order to get you better. That way now you can definitely plan for your finances, or let it be your insurance or whatever situation you may have, that now you can address it and take care of it and make sure that you get your smile back the way you want it to be. Here at Dental Designs, we pride ourselves in providing that option for patients. So again, you can always contact us at Dental Designs in Naples and Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. One of the innovations that we've brought to Dental Designs is the use of Velscope. Velscope allows us to provide early detection of cancerous lesions inside the oral cavity. Therefore, the sooner that we can detect the cancer in the oral region, the faster we can treat it, and that way we can keep our health as best as possible. So we highly recommend that you call us at Dental Designs at 239-628-1300, or you can contact us through topdentaldesigns.com. Dental Designs, more than a smile. I've always been asked the question, how much can I save with Medicare? Medicare has certified us at Dental Designs to be the office in Southwest Florida that has the unique benefit of being able to provide their Medicare patients with benefits for implant dentistry reconstruction. So the question is, how much can I save? Patients that have used this program have been able to save from 40 to 70% of the cost of their typical implant treatment or sometimes even extraction treatments, and some patients have been covered completely by this program. Again, we always encourage patients to bring their situation and also bring their information from Medicare in order to find out, one, if you actually qualify for this program, and second, to what extent is your need. And getting you something much more stable so you can eat and function in these later years in your life. You can always contact us at Dental Designs in Naples and Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. What is root canal therapy? Root canal therapy, or endodontics, is when our tooth is failing, or has fractured, or is actually dead. Now, we want to keep that tooth in place, but in order to do so, we have to eliminate the factor that's causing the infection. Therefore, we go through the middle core of the tooth where we find the roots. Once we locate those canals, we can actually clean out that infected tissue. In many situations, we actually place a crown over it because once the tooth has lost its supply of nutrients, it tends to dry, and we do not want you to fracture this tooth in half. Therefore, most teeth that have root canal therapy do need to have a crown placed over it in order to make sure that we can use this tooth for many years to come. Again, you can always contact us in Naples or Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. Can a dental infection cause death? Dental infections usually arise whenever there is either dental decay that has affected a tooth, trauma, fracture, anything that has happened to that tooth that now the tooth is actually infected, and this infection will proliferate within the tooth, making it far more complicated to treat. Some patients believe that treating it with antibiotics will get rid of the infection, but that's a fallacy. Once you treat the infection with antibiotics, you definitely need dental treatment to be done in order for that infection to not recur again. If that infection is left long enough in the area and is left untreated or not treated properly, yes, it can complicate more areas of the body and gradually will cause a major infection that can actually lead to actual death. Actually, there's a case from California of a gentleman that actually went through the same process. He thought antibiotics would take care of it, and along the way, the antibiotics just could not do anymore, and now, of course, he's deceased. So we want to make sure that we take care of these infections as soon as possible. And again, we have different various treatments that we can actually do in order to make sure that this infection can be under control. You can always reach us at Dental Designs in Naples and Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. What are the symptoms of a tooth infection spreading? When a tooth infection starts to spread, of course, we feel some discomfort. There's usually swelling. Your nose may start getting inflamed. And these are things that we want to avoid, especially because we want to make sure that your health is primary and important. Not taking care of that infection can lead to more problems, like heart conditions or even death. So we want to make sure that we get the infection under control. Antibiotics are sometimes not just sufficient. It's best if you take care of whatever the sources of your infection so you can avoid further complications not only in your mouth but also all your overall health. So paying attention to these signs and symptoms are critical to making sure that your health is in primary and optimal shape. You can always contact us at Naples or Fort Myers at 239-628-1300 or at topdentaldesigns.com. Dental Designs, more than a smile. Dental Designs, más que una sonrisa.
Visit us in our offices in Naples and Fort Myers. Find us at topdentaldesigns.com and call us at 239-628-1300.
Dental Designs, more than a smile.
Hi, my name's Chris Moon. I produced and discovered the superstar Prince, so I know what real talent is. When I needed new teeth, I spent 5 years all across the country interviewing dentists, looking for the right person. Finally, I found Dr. Padilla, and he gave me a full dental set of implants. And I can tell you, as someone who knows, he's a rock star.
Dental Designs, more than a smile. Our goal is to provide you with an outstanding service.
We have the most qualified team to provide the highest quality treatment.
We work with the highest technology.
We provide all types of dental services.
Everything in the same place.
We take care of you.
Dental Designs, more than a smile.